Hi, Dr. Stevens. I don't know why my computer is being so weird, and I do apologize, but this is my evidence video presentation where I'm trying to show my entire screen because it's not just letting me show the presentation and myself. So I'm just going to be showing a little bit of both and going back and forth. So I do apologize for how everything is going down with my computer. I don't know what's going on. Um, so, I am Lauren Freeland, and today I'm going to be discussing the importance of evidence based practices to reduce development of pressure injuries. The topic that I have chosen is pressure injuries because I am currently a med-surg telemetry nurse and I have seen an increase in pressure injuries. This is kind of a topic that I wanted to research a little bit more on and get a better understanding of evidence based practices to reduce the risk of pressure injuries in development, which the quantitative and the qualitative research articles that I have both found have definitely gave me a better understanding of what to implement, which is the importance of repositioning my patients every 2 hours, doing the Braden scales and the scores and the nutrition and whatnot. So my PCOT question was an adults age 65 and older admitted to the medical surgical unit, which is the unit I work, patient population. How does the implementation of the intervention, repositioning a patient every 2 hours, which is the intervention supported by research and within the scope of practice of an RN, compared to not repositioning the patient, which is comparison intervention, affect the development of pressure injuries and ulcers, which is the outcome within the patient's hospitalization stay, which is the time. So, the justification of me using both of these articles to support reducing the pressure injury development and whatnot is the quotes that I have found on this slide here, which is to investigate the effectiveness of the Universal Pressure Injury Prevention Bundle, and but the reason why this needs to be investigated even further of the reduction of the injuries is because not only does it cause patient harm, but it can also result in patient death and include a longer stay in the hospital. So the summary of evidence, I found that this was quite difficult to come up with. I would say this definitely took me the longest. This slide did. To find the study design, the purpose, sample size, and characteristics, methods, and findings. But once I had constructed this chart, it gave me a better understanding of what these articles really were trying to find at the end of the day. What was the end result and how did we get to the end result? The two patterns in the data that I can identify within both of these articles is pressure injury prevention bundles, and that include repositioning and the nurses being properly educated within these bundles as well. One strength of the data was that they found that frequent repositioning did result in less pressure injury risks. And one limitation of the data was I kind of wish that they would have incorporated how many patients they did incorporate within the study. Each study that they conducted from both articles. Some recommendations, again, was just to reposition the patient every 2 to 3 hours. And the conclusions and how I found the evidence within both articles discussed to support my clinical question was really thoroughly examining both of the articles and understanding what the main reduction, the main intervention was in reduction of pressure injuries, which was to turn the patient every 2 to 3 hours. Um, I will definitely be taking this with me to my current workplace. I am a travel nurse. The hospital that I do currently work for, I have already identified at least 5 patients with pressure injuries because these patients are not being repositioned frequently. So I will be bringing this presentation forward to the manager, and I thank you for giving me this assignment and this opportunity to look further into why evidence based practices and interventions are important to reducing the risk of pressure injuries. Thank you.